Welcome to the deep dive. Today, we're diving into the world of M-mode echocardiography.
Oh,
You
yeah.
might be thinking,
Yeah.
M-mode?
Yeah.
Isn't that a bit old school?
Right.
And you'd be right. It's been around for a while, but we're here to explore why this technique,
Yeah.
despite its age,
Yeah.
is still so relevant and even essential in cardiology today.
I think it's really cool.
Yeah.
What's really intriguing is that M-mode gives us a unique perspective on the heart's movements,
Yeah.
something that even the most sophisticated 2D and 3D imaging techniques can't quite replicate.
Okay, so let's break this down for those who might not be familiar.
Sure.
Can you give us a quick rundown of what M-mode echocardiography is and how it works?
Imagine a single beam of ultrasound, like a spotlight sweeping across a section of the heart.
Okay.
M-mode captures the depth information along that beam and displays it as a graph of motion over time.
Okay.
So instead of a flat two-dimensional image,
Yeah, we get a dynamic record of how a specific part of the heart is moving almost like a seismograph for your heart.
that's a great analogy. It helps to visualize how M-mode works, but I'm
Yeah.
curious, you mentioned that it complements 2D and 3D imaging.
Yes,
Why is that?
sure.
If those technologies offer more comprehensive views of the heart, what makes M-mode still so valuable?
The key lies in its superior temporal resolution.
Okay.
M-mode boasts an impressive sampling rate of around 1,800 per second,
Wow.
compared to 2D echocardiography, which typically samples at 30 per second.
Okay.
This means M-mode can detect incredibly subtle, rapid movements that could be missed by other methods.
Got it.
Think of it like this 2D echo gives you the wide shot, the big picture,
Okay.
while M-mode allows you to zoom in and slow down the action,
Wow.
capturing those blink and you'll miss it moments that can be crucial for diagnosis.
So it's like creating a wide-angle lens for a high-speed camera,
That's accurate.
capturing details that would otherwise be lost.
Yeah.
That makes a lot of sense.
But how does this translate into real-world applications?
Okay.
What kind of conditions can M-mode help diagnose that might be tricky to spot with other techniques?
Let's take the example of mitral valve problems, specifically a condition called flail mitral valve.
Okay.
M-mode can clearly show us if the valve's leaflet is moving in the wrong direction, a telltale sign of a problem.
Hold on. What do you mean by moving in the wrong direction?
Oh, yeah.
Isn't it supposed to move in a specific way?
Exactly. Normally, the posterior leaflet of the mitral valve moves backwards during the heart's relaxation phase.
Uh-huh.
But with a flail leaflet, it moves forward instead.
Oh, okay.
This unusual movement, easily detected by M-mode's high sampling rate, indicates a problem with the valve.
And I'm guessing catching this early is important.
Yes.
Right. What are the implications if a flail mitral valve is left untreated?
You're absolutely right. A flail mitral valve can lead to mitral regurgitation, where blood leaks back through the valve instead of flowing forward as it should. This can put a significant strain on the heart and eventually lead to heart failure.
Oh, wow.
M-mode's ability to spot these subtle movements early on can be life-saving.
Yeah.
It allows for timely intervention and a much better chance of managing the condition effectively.
That's incredible. So M-mode is like an early warning system,
Yes.
alerting cardiologists to potential problems before they escalate.
Precisely. And it doesn't stop there. M-mode is also extremely useful in diagnosing atrial septal defects, or ASDs.
I've heard of ASDs.
Go.
Like, can you remind me what they are?
Certainly. An ASD is essentially a hole in the wall that separates the heart's two upper chambers, the atria.
Right.
When this hole is large, it can cause a significant amount of blood to flow from the left atrium to the right atrium,
Okay.
which is the opposite of what should be happening.
So how does M-mode help detect this?
M-mode can reveal telltale signs of a large ASD, like a dilated right ventricle, and something called paradoxical septal motion. Normally, the septum, the wall between the heart's chambers, moves towards the left ventricle during contraction.
Uh-huh.
However, with a large ASD, the increased blood flow to the right side of the heart causes the septum to move towards the right ventricle instead. This paradoxical movement, again, is easily picked up by M-mode's high temporal resolution.
That's fascinating. It's amazing how M-mode can pick up on these subtle variations in movement and signal a potential problem.
It really is.
Now, speaking of unusual movements, I understand M-mode can also be helpful in diagnosing left bundle branch block, or LBBB.
Absolutely.
Can you tell us a bit more about that?
LBBB is a condition that affects the electrical system of the heart, causing a delay in the activation of the left ventricle. This delay can lead to the heart's chambers not contracting in a coordinated way, which we call dyssynchrony.
Okay.
M-mode is particularly good at detecting this dyssynchrony.
And why is it important to know if someone has dyssynchrony?
Well, for starters, it helps confirm the diagnosis of LBPB. But what's even more interesting is that M-mode can actually help predict how well a patient might respond to a specific treatment called cardiac resynchronization therapy, or CRT.
So it's not just about diagnosing the condition, but also about tailoring the treatment?
Exactly. If the dysynchrony measured by M-mode is greater than 130 milliseconds, there's a high probability that the patient will benefit from CRT.
Wow.
So M-mode can actually guide treatment decisions and potentially improve patient outcomes.
Yeah.
It's more than just a diagnostic tool. It can be a powerful tool for personalized medicine.
That's remarkable. It seems like M-mode is a real game changer in cardiology.
It is.
But you mentioned earlier that M-mode could even help in life-threatening situations.
Yeah.
Can you give us an example?
Of course. Let's consider infective endocarditis, a serious infection of the heart valves.
Okay.
This condition can be extremely dangerous, especially if it leads to complications like shock.
Right.
In such critical situations, M-mode can quickly reveal crucial details about the severity of the infection, helping doctors make life-saving decisions.
Wow.
For instance, M-mode can show if the mitral valve is closing prematurely,
Okay.
or if there's a mass obstructing the left ventricular outflow tract, both of which can indicate the need for urgent aortic valve replacement.
Wow. So in a situation where every second counts,
Right.
M-mode can provide vital information, quickly giving doctors the insights they need to act fast.
Exactly.
It's incredible how much information can be gleaned from this seemingly simple technique.
Yeah.
It's like a hidden superpower in the world of echocardiography.
It is.
But I'm curious, is it always this straightforward?
That's a good question.
Are there instances where M-mode can be tricky to interpret or lead to some head-scratching moments?
That's a great question, and the answer is yes.
Okay.
While M-mode is incredibly valuable, it's not without its nuances and occasional mysteries.
Yeah.
Sometimes the findings can be a bit counterintuitive,
Okay.
and it takes a trained eye and experience to interpret them correctly.
That makes sense. I'm intrigued. It sounds like we're about to delve into the realm of M-mode mysteries.
We are.
I can't wait to explore those.
Let's dive in. We'll uncover some of those intriguing cases where M-mode can throw a few curveballs. One of these intriguing cases involves aortic regurgitation.
Okay.
It's a condition where the aortic valve, which controls blood flow from the heart to the rest of the body, doesn't close tightly, allowing blood to leak back into the left ventricle.
Ah, so it's like a leaky faucet,
Right.
but in the heart.
Exactly.
That can't be good. What does M-mode show us in this situation?
Well, what's interesting is that M-mode can sometimes show a fine fluttering of the mitral valve.
Wait, the mitral valve?
Yeah.
But the problem is with the aortic valve, right? Why would the mitral valve be affected?
It might seem counterintuitive,
Yeah.
but the backflow of blood from the aorta into the left ventricle can create turbulence.
Okay.
This turbulence can affect the mitral valve, causing it to flutter slightly.
So seeing this fluttering on the M-mode could be a sign of aortic regurgitation. That's pretty amazing.
It can be a clue, yes.
Hmm.
However, and this is where the mystery comes in,
Yeah.
it's not a foolproof indicator.
Okay.
The degree of mitral valve fluttering doesn't necessarily correlate with the severity of the aortic regurgitation.
Oh, so it's not as simple as more fluttering equals more leakage.
Right.
What else do cardiologists need to consider?
They need to look at the bigger picture, considering factors like the size of the left ventricle
Right.
and the pressure difference between the aorta and the left ventricle. These factors play a significant role in determining the severity of the regurgitation.
That makes sense. It's a reminder that M-mode, while powerful,
Yeah.
is just one piece of the puzzle.
Right.
It's about combining its insights with other clinical findings to get a complete understanding of what's going on.
Absolutely. Now let's move on to another intriguing case, pulmonary hypertension.
Okay.
It's a condition where the pressure in the pulmonary arteries,
Yeah.
which carry blood from the heart to the lungs, is too high.
Uh-huh.
And M-mode has a particularly striking finding for this one.
Oh, I'm all ears. Tell me more.
M-mode can reveal a distinct flying W pattern on the pulmonic valve,
Okay.
which is the valve controlling blood flow from the right ventricle to the pulmonary artery.
A flying W.
Yes.
That's an image that definitely sticks in your mind. What causes this unusual shape?
The flying W pattern is caused by the altered motion of the pulmonic valve leaflets.
Okay.
The increased pressure in the pulmonary artery forces the leaflets to move in an atypical way,
Yeah.
creating this distinctive W shape on the M mode.
So it's like the pulmonic valve is struggling to open and close against that increased pressure.
Yeah.
resulting in this unique pattern.
Exactly.
It's almost like the valve is sending a visual SOS signal.
That's a great way to put it. It highlights how the physical forces within the heart can manifest as visual clues on the M-mode,
Yeah.
providing valuable insights for diagnosis.
Speaking of visual clues and potential emergencies, I know we were going to talk about cardiac tamponade.
Yes.
Can you remind me what that is again?
Cardiac tamponade is a life-threatening condition
Okay.
where fluid builds up in the pericardial sac, the sac that surrounds the heart.
Right.
This fluid compresses the heart, restricting its ability to fill properly with blood.
That sounds incredibly dangerous. How does M-mode play a role in diagnosing and managing this condition?
M-mode's high temporal resolution makes it incredibly valuable in this scenario.
Okay.
It can clearly show diastolic right ventricle collapse, where the right ventricle collapses inward during the heart's relaxation phase due to the pressure from the fluid buildup.
So the right ventricle is essentially being squeezed by the excess fluid.
Exactly.
What else does M-mode reveal?
It can also show a phenomenon called pulsus paradoxus.
Okay.
This is where the left ventricle size decreases during inspiration, which is when you breathe in.
That seems counterintuitive. Shouldn't the left ventricle get slightly bigger when you breathe in?
You'd think so.
Yeah.
Normally, during inspiration, there's a slight increase in the amount of blood returning to the right side of the heart.
Right.
This increase is usually accommodated by a slight expansion of the left ventricle. However, in cardiac tamponade, the pressure from the fluid restricts the heart's ability to expand normally.
Yeah.
As a result, the left ventricle actually gets smaller during inspiration, which M-mode can clearly detect.
Wow, that's fascinating. So M-mode's ability to show these subtle changes in ventricular size over time is crucial in diagnosing cardiac tamponade.
Precisely. It allows for prompt diagnosis, which is vital in this situation, as cardiac tamponade requires immediate treatment to relieve the pressure on the heart.
It's amazing how a technique that might seem old school can provide such critical information,
It is.
especially in emergencies. But we've talked a lot about how M-mode is used for diagnosis.
Yeah.
Are there any other applications beyond just identifying conditions?
There are. For instance, M-mode can also be used to assess hemodynamics,
Okay.
the forces involved in blood circulation.
Yep.
One common application is estimating right atrial pressure.
What is right atrial pressure and why is it important to know?
Right atrial pressure reflects the pressure in the right atrium,
Uh-huh.
one of the heart's upper chambers.
Okay.
It gives us valuable information about the heart's overall fluid status
Right.
and can provide insights into conditions like heart failure.
Okay, so how does M-mode help us figure out the right atrial pressure?
We can estimate it by looking at the size of the inferior vena cava, IVC, on the M-mode.
Okay.
The IVC is a large vein that carries deoxygenated blood from the lower body back to the heart.
All right.
Changes in its size can indicate changes in right atrial pressure.
So by observing the IVC on an M-mode, doctors can get a sense of the patient's fluid status and potential heart function issues. That's pretty clever.
It is. And this is just one example. M-mode can also be combined with color Doppler to create what we call color M-mode.
Color M-mode, what's that all about?
Color M-mode takes the depth and motion information of traditional M-mode
Okay.
and adds the dimension of color Doppler, which shows us the direction and velocity of blood flow.
Uh-huh.
It's a powerful tool for visualizing blood flow patterns within the heart.
So it's like adding real-time traffic information to a roadmap of the heart. What kind of things can you see with color M-mode that you can't see with regular M-mode?
With color M-mode, we can see the precise timing of valve movements,
Yeah.
the speed and direction of blood flow through the valves, and even identify any areas of turbulence or backflow.
Yeah.
It's incredibly helpful in assessing valve function and understanding how blood is actually moving through the heart.
Wow. It's like taking a virtual tour through the heart's inner workings. We've uncovered so many amazing applications of M-mode today,
Yeah.
from diagnosing life-threatening conditions to assessing heart function in a really nuanced way.
Yeah.
It seems like M-mode is much more than just a historical footnote in echocardiography.
Absolutely. It's a testament to the ingenuity of this technique and its enduring relevance in cardiology.
Yeah.
Our sources actually listed 10 key reasons to love M-mode.
Wow.
Some of those intriguing benefits include its ability to provide a clear understanding of left atrial hemodynamics,
Okay.
easily evaluate synchrony,
Mm-hmm.
identify high-frequency motion that other methods must miss,
Oh.
evaluate pulmonary hypertension, even without tricuspid or pulmonic regurgitation,
Okay.
and offer insight into the mechanisms of pulsus paradoxus and tamponade.
This is an incredible list. And to think all of this from a technique that some might consider outdated, but there's one point you mentioned that I find particularly mind-blowing.
Oh, yeah.
You said that M-mode can sometimes diagnose arrhythmias,
Yes.
which are irregular heart rhythms,
Right.
better than an EKG.
Mm-hmm.
That's incredible.
Is remarkable. M-mode's ability to capture those subtle, rapid changes in the heart's movements gives it an edge in certain scenarios.
Yeah.
It's a perfect example of how sometimes the seemingly simplest tools can offer the most profound insight.
It really makes you wonder what the future holds for M-mode,
I know, right?
especially in an era of wearable health technology.
Yeah.
Imagine the possibilities if we could harness the power of M-mode in a device you could wear on your wrist.
Right.
It could revolutionize how we monitor and manage heart health.
That's a fascinating thought. The potential is certainly there. It's exciting to think about how this seemingly old-school technique might pave the way for future innovations in cardiac care.
It really is. Today's deep dive has been a real eye-opener.
It has.
I went in thinking M-mode was this outdated technique,
Right.
but it turns out it's this incredibly powerful tool with so much to offer.
Yeah, it's a perfect example of how sometimes the most valuable tools aren't always the newest or flashiest.
Yeah,
M-mode has stood the test of time for a reason.
absolutely. It reminds me of that saying, if it ain't broke, don't fix it.
Right.
But in this case, it's more like, even though it's old, it's still incredibly useful and relevant.
Yeah, that's a great way to put it. M-mode might be a classic technique,
Right.
but its insights are timeless. It allows us to see the heart in a way that other technologies simply can't replicate.
It's like having an extra set of eyes.
Yeah.
Or maybe even a superpower that lets you see those hidden details of the heart's movements.
Exactly. It's about looking beyond the surface, delving deeper, and uncovering those subtle clues that can make all the difference in diagnosis and treatment.
Well said. So as we wrap up this deep dive into the fascinating world of M-mode echocardiography,
Yes.
what's the one key takeaway you want our listeners to remember?
I think the most important thing to remember is that M-mode is not just a relic of the past. It's a vital tool that continues to play a crucial role in modern cardiology.
Right.
While newer technologies offer valuable insights,
Yeah.
M-mode provides a unique perspective that complements and enhances our understanding of the heart. It's a testament to the enduring power of a simple yet elegant technique that allows us to see the heart's secrets in a way that nothing else can.
Beautifully put. It's a reminder that sometimes the oldest tools in the shed are still the sharpest. And in the ever-evolving world of medicine,
Right.
where innovation is constant, it's inspiring to see how a classic technique like M-mode continues to hold its own, offering valuable insights that help us better understand, diagnose, and treat heart conditions.
Couldn't have said it better myself.
Well, that brings us to the end of our deep dive. I hope you found it as fascinating and enlightening as I did. Until next time, keep exploring, keep learning, and never underestimate the power of a classic.